I thought Eric would be a good asset to the panel today because these are the types of calls that he receives every day on the radio, and they have these discussions. So he's very aware of what the community's concerns are.
Well, this is an open conversation. So, Attorney Lucas, how are you? And welcome.
Thank you. Thank you. I'm doing pretty good. I'm just excited to be here and to share my thoughts and input with the group and with the community regarding COVID-19 and how it affects us as a whole.
Absolutely. Thank you, Attorney Lucas. And of course, from Hot 93.7, Eric, how are you?
Very well. Thank you. Thank you guys for having me. I'm just very excited to have this discussion and maybe share some insight, share some of the thoughts and concerns that I receive on a daily basis. Very connected with the community, and we have conversations on a regular basis regarding COVID-19 and the vaccinations and people's concerns, people's fears, and so on. So it's very exciting right now to be able to project these thoughts on a broader scale.
Pretty good. Thank you. Thank you. All right, so let's move forward because I know people is watching right now and they really want to get into this conversation. So the state of Connecticut is moving forward with the vaccination. Yesterday, the governor, Ned Lamont, announced that people from 55 plus will be able to, have access to the vaccine, right? So we're moving pretty good, right, on that one. But the reality over here are the blacks and Latinos, the minorities are a little behind. Janaya, what do you think?
I believe we are, and I believe a lot of it has to do with past traumas, cultural issues that have happened to us historically. And so the stigmas that come along with it, and majority of it overall is a trust factor. And when you talk to most families and you hear their opinions, it's about trust, not being able to trust politicians, doctors, and so many other organizations that play into, bringing the communities together for the vaccination. So it's a trust issue.
Absolutely. To prove these statistics, we want to show you guys, some reports from the DPH. So I'm going to ask our producer to share those numbers with us so you can see where the Latinos and African Americans are, right? As you were saying, we're a little behind. So can we share an image where people can see those numbers, that report from the DPH? Pedro? So can you share the image so we can see it? But in the meantime, we can talk about Bernard. Let's go to New Haven. How behind are those, are the minorities out there?
We're real behind, and the thing is that some is taking it, but what was spoken about before is people are hesitant, and they're hesitant for some for good reasons, and some are not good reasons. But what we try to tell, and what we're beginning to tell our residents, is think about the people in your household. Who do you care about most? What is the most important thing to you right now? And everyone is going to say their families. And if your family is the most important piece in your life right now, you have to think outside the box. You have to think outside what your myths and fears are, because every day we walk out the house, we take a chance on something happening. It don't matter what that chance is. Somebody might hit you with a car. I mean, I'm going extreme, but these things do happen every day. And we just have to take this opportunity to take a chance to protect the very people we say we love. And if I love my family, I'm going to do whatever it takes to ensure that my family's protected. And this is one of the pieces we have to put out. Secondly, we want people to talk to people that are right there in their communities that were that caught COVID or was infected by the virus of COVID, and the very thing they went through and the reasons why they getting vaccinated for that very reason, because they know exactly how it feels to have this deadly virus. And I was talking to a brother today, and that's the first thing he said. If you don't want to take the vaccine, then what is your plan? If you don't want to be vaccinated, then what plan do you have to protect your family? We can't force people to get vaccinated, neither will we force them, but we just want them to make sure they have all the facts. Just don't listen to people around the corner, old dude on the block. Go get the facts, know all of the facts. And that's what we're trying to present here in New Haven, is to give our residents the pure facts of what can possibly happen, what may happen, Will some people get infected? All of those things that they're scared about. But the biggest piece is we're fighting a very deadly disease, and we have an opportunity to do something about it. Lastly, and I'll shut up, the last thing that you have to do is think about, going back to normalcy. How do we get back to normalcy in our communities? Yeah, we want to go outside. We want our kids to go back to school. We want our kids to be able to go outside and play. How do we get to that place of normalcy? Is this vaccine one of the things that can help us to get some form of normalcy back in our community? And if it is, let's jump out there and find out, and actually talk to the people that's been vaccinated as well, and nothing has happened to them thus far. But talk to your neighbors that have your elderly that have already been vaccinated, and some of us that got vaccinated because we're working healthcare.
Lucas, it seems like this is not just an issue in New Haven. I think Hartford is seeing this issue as well. Our communities are a little behind. What do you see in Hartford?
Yeah, I see it in Hartford where some people are looking and they are lined up. They do want to get the vaccine. And it's also going to come down to mainly if it's something that you do want to do for the sake and benefit of those around you. Some people are going to go ahead and get it, where some people, they're just going to ride it out. I remember having a conversation with, several individuals where they said, because of the speed and time that the vaccine was produced, they're going to ride it out. And same thing, I would echo the same sentiment where, okay, but make sure you have a plan to protect you and your loved ones, or to at least protect yourself, because unfortunately this virus is here to stay and it's not going anywhere.
Correct. Eric, I know you have, connections and interactions with a lot of people in your community, but you work on radio, and let's say that a lot of youth, hear the radio and connect with you. What do they think about the COVID-19 vaccine?
There's a lack of trust on a large level, because there's so much documentation where, we've been, as a community, as an African American community, there's studies, there's things that have happened in the past where we were quote unquote guinea pigs, and this is the stuff that I'm getting. And so some people are saying, yeah, you're saying protect our families at all costs by taking the vaccine, but I'm saying protect my family at all costs by not taking the vaccine, because who's to say that this isn't something that's going to harm me down the road? So there's a lot of fear when it comes to this, and there's a lot of questions that are still unanswered, especially in the African American community. If you go back in time and you study the history of it, where, there's cases coming out now from the 60s where, we were used as guinea pigs for certain things, or we were intentionally poisoned in some cases. We knew that certain things were not good for us, or were not good for people, and it was targeted to the African American community. There's a lot of myths out there. There's a lot of unanswered questions. So for every argument that someone is saying towards take the vaccine, there's another argument to argue why not to take the vaccine. And so that's the biggest challenge in the community, and that's where the disjoint is. And I think, it's such this rush, hey, we have to take the vaccine, we have to take the vaccine. And everyone else is like, hold on, we need to have a conversation. And it's like, well, we can have the conversation later, just take the vaccine. And people are like, I'm not taking the vaccine until we have the conversation. So you have this constant tug of war. And I think on a larger scale, everyone's forgetting about that piece, or everyone's trying to put that piece to the side and say, you know what, just get over it. We have this going on right now. Take the vaccine right now because we say that it's safe. And in the inner city communities, no one trusts that argument because of what's coming out now or what they know from the past. So those are the types of calls that we're receiving. Those are the types of conversations that we're having in barbershops and salons here in the Hartford area. And I'm sure it's happening in every area, but myself speaking from people who I talk to in the Hartford area, and I know it's easy to say, hey, let's protect our families. Let's stop the spread of this, this horrible disease. It's taking our lives, people who I know. But there's that argument, and people are literally scared. People are really scared. And so to say, hey, we're going to roll out the vaccines, and there's no conversation, It's like, okay, well, you're saying you don't care about how I feel. Just take this because we said so. And that's not enough for these people who are genuinely scared of this vaccine.
Absolutely, Zendaya. Eric is bringing a lot of points to the table. Definitely, those are factors why people are not making appointments to get the vaccine. What do you think, Zendaya?
They're all 110% correct. And one of the other issues is, you know, trying to minimize the rumors and conspiracy theories. There's a lot of people who don't watch the news and they rely on social media, and everybody, doesn't know how to differentiate the facts, from the fiction that goes across social media. So, I think the panels that we're having that we're putting together, the groups and community conversations that we're having isn't because the facts is going to be the antidote for these issues.
Absolutely. Let me share the images one more
6:30.
time because I really want to talk about that. Our producer, can you please share the images that you were sharing before? Because I want to focus on that and show you what the DPH report shows. If you see right there, and people from 16 plus, I'm sorry. So doses administered is 11,385. So that's 3.4% out of the whole population in Connecticut, which is 257 and 809. So that means that the first dose coverage is only 4.4%. That's on the African Americans. If you see the Hispanics is 17,443 doses administered, right? And the percentage of doses administered, it will be, let me see, 5.2%. So, and the population is 336 and 471. But if you compare those to the wide community, definitely we're behind. So maybe it's a lack of information. I want to go to New Haven again. Bernard, do you think it's a lack of information? What do you think it is?
I really don't think at this point, to be very honest, with so many webinars and so much information that's been disseminated out to this community and out to the state, that it's a lack of information at this point. I think sometimes it just comes down to the lack of will. And it was already said, a lack of trust. And New Haven definitely is a lack of trust. And I don't necessarily think it's just, to things that really happened to us in the past. Yeah, that stuff comes up. But I just think to things that have happened more recently and a lot of things that are happening right now where people just don't trust how fast this was put together. One guy in a webinar that we were on, one of our pastors here stated, well, we have HIV that's been around for years and we have yet to come up with a vaccine or anything to cure HIV. But now we have another deadly virus in our midst, and they come up with a virus within 8 months. And so that brings that fear piece back again. And I think a lot of that is happening right here. So I don't think it's a lack of information. I just think it's just a lack of will at this point.
So I want to talk to Attorney Lucas. What do you think? Do you think it's a lack of information in Hartford, or do you agree with Bernard?
I think there's enough information out there. I think there's just a healthy level of skepticism, as Bernard has said, and I think it's a thing where people are at a crossroads. From my own knowledge, figure I've looked at drug companies or been involved in lawsuits with drug companies and figure the normal drug can take anywhere up to 5 years to make, and this is something that was produced within months. And at the same time, some of the drug companies that are producing the vaccine have added disclaimers in their literature saying, hey, guess what, if you get sick from this or you have some life-altering ailment, you can't come back and sue us. So you're pretty much doing this at your own risk. And at the same time, there are some people, such as I have a family member that is a healthcare worker, and they've already went through and got both doses of the vaccine, and they're doing fine. So, I think it's one of those things where people are at a crossroads in terms of the speed at which it was took. the speed that it took to put this vaccine out, as well as, I'm going to get it because I don't, some people don't want to have any of the debilitating effects that we've heard about um, the virus doing to people, such as deaths or, permanent lifelong injuries. So, I think we got enough information. It's just one of those things where people are going to have to decide for themselves.
Thank you, Lucas. Definitely, the COVID is out there. So right now, I wanna mention to you the positivity rate right now for COVID-19 in Connecticut, according to the governor Ned Lamont, it is 3.92%. So the COVID is out there, but the vaccine is also out there. So, but the people don't want to have, the vaccine. They want to get access to it. So, Eric, what do you think we should do better? If it's not lack of information, because the information is out there, there are webinars, the vaccine is out there, we have it out there. And everyone was hoping, maybe 9 months ago for a vaccine. Now that we have it, what do we need to do better so our communities get access to it?
That's a really tough question because there's so much doubt. There's so much fear. There's so much distrust. There's so much distrust, so much fear, so much doubt that I don't even know if there's a proper answer to that. I mean, we could have as many meetings as we want to have. We could have all types of information sessions. But at the same time, there's still a lack of trust. A lot of it is maybe due to the small amount of time that it took to come up with the vaccines. There's so many factors weighing into this. And it's like, how do we figure out how to make this thing work? Or how do we find a way to get this to people so that they can trust that it's really valid? And right now, it's talking to some people, it seems like it's impossible. Some people are on the fence, but there's so many questions that still need to be answered. There's so many old questions that still need to be answered that we have to find a way to bridge that gap in communication. And I think right now with, okay, we have the vaccine, it's out there, it's available for us. We need to be taking it. That's not enough for those people who have unanswered questions. That's not enough for those people who still have a whole lack of trust. And I mean, there's a whole narrative, as Jendaya referenced, people are not taking their information from media outlets. Everyone's on the internet. And there's so many conspiracy theories right now that people have actually brought into these things. And so there's people thinking that this is a form of population control. There's so many theories that I've heard out there. So we have to find a way to get to those. And so it's going to be a long process. It's going to be a long process because their lack of trust is really strong. There's a strong lack of trust in the system right now. And so there are some people who won't believe anything. I mean, their mother, who they respect the most, could tell them, this is the best thing for you, you should do this, and they will still say no because they have that much distrust in the system.
Definitely.
I'm sorry, that Eric and I discussed earlier, is we also have been misled by people who look like us. So if we have these minority leaders who we began to build trust in and follow them, who turned around and did something that was for personal gain and ended up hurting people in the community, they really don't have any trust, and it just runs really deep.
Yeah, absolutely. So I want to share with you some footage.
Is grandma in the kitchen?
Donuts Park just a couple weeks ago. There's people
Go to
getting
the door.
vaccinated. So reality is the vaccine
Pull it
is
towards you and
successful
hit the
to
lock button.
everyone. Not everyone, but I would say it's 75 plus and 65 plus. And with the announcement,
Wait till the thing goes
5 plus is starting next Monday. So as you see right there, there's people getting vaccinated in Hartford Yard Goats, or, that's the house of Hartford Yard Goats, but it is Dunkin' Donuts Park. Jendaya, when you see images like this, what does it come to your mind? Do you wish that people in your community should get vaccinated, or what does it come to your mind?
Honestly, I do think it's a personal choice. I I can think a lot of things, but we also have to put ourselves in their shoes and at least try to understand why they feel the way they do. And so, speaking with a lot of elders, because I feed a lot of seniors, and when they speak on just so many historical issues back to their ancestors and different things. And, a lot of them will say, hey, I've never had a flu shot or this one or that one. And I made it thus far. I'm 80 plus years old. So, I can ride this out as well. A lot of people also feel like, and like Eric said, population control. They've had loved ones lost to cancer and so many other diseases and illnesses. And it's like, hey, they came up with this vaccination so fast. How come they couldn't do this for cancer or, any other disease to save my family? Why this and why now?
Absolutely. Jindaya, do you have some comments on your screen? You were looking at your phone, so I wanted to bring some, opinions and what people is saying online right now.
There's a question for well, there's a comment, it looks like, for Eric from Danielle McBride. It says, thank you, DJ Big Man. Fear, doubt, distrust is not unwarranted. Since when do ignore prior lessons and evidence of what trusting in our government looks like?
Right. I wanna go back to definitely Eric. So the people that you work with all the time, you work on radio, right? Let me put it this way: you have the power sometimes in your words. If I ask you right now, what message you would like to bring to your community right now, what will you say? You have an open mic right now.
It's a difficult. Wow. See, the problem is that the argument is valid on both sides. So trying to convince someone to go against what their fears are and what they believe in when they can provide documentation and say, this is the reason why I feel this way. This is the reason why I feel this way. And it's valid. It's hard to argue against that. And, wanting to have that open and honest discussion and wanting people to understand that you care about what their thoughts are, to tell them at the same time, okay, yeah, I get it, but you still need to do that. It's kind of like you're dismissing what they're feeling and you're dismissing what they're thinking just to say, okay, still do what I tell you to do. Do what I tell you to do. So even me telling them, hey, you have to do this because this is, the vaccine is there, let's take the vaccine. They're still going to say, well, and this is going to be their honest question. They're going to say to me, well, who paid him off to make that statement? This is the level of distrust that's out there. When they hear that come out of my mouth, they're going to say, he's been paid off, so we can't trust him anymore. Now he's with them. It's almost an us against them situation. And so I think there's still a lot of conversation that needs to be had. And I know we can all say, we need to do what's in the best interest of our families. Let's protect our families. We can say that till we're blue in the face. But for as long as people feel like, what about my uncle who told me this story about his friend who took this shot years ago and then he had all of this happen to him afterwards and they told him that he would be fine. So these are the arguments that we're faced with all the time. And it's a constant tug of war. And I think I get the sense of urgency because we have this pandemic that's raging on. The numbers are going up and down, up and down, up and down. And it's just like, how do we get a grasp on it? And we feel like, okay, we have a vaccine. Everyone should be on board with the vaccine. I know some of you have lost loved ones and everything else, but then there's still the questions that haven't been answered. And it's like, why aren't you answering my questions, but you're telling me to take this shot? You're still not answering my questions, but you're telling me to take the vaccine. But you're still not answering my questions, but you're telling me to take the vaccine, and then you're going to answer my questions. So it's like, I want my questions answered first, and then we can sit down at the table again and talk about the vaccine.
Thank you, Eric. So I want to go to New Haven, to Bernard, because a lot of people in Connecticut were saying, okay, if the governor gets the vaccine, I'll get it. I think we heard those comments a couple months ago. Now the governor, Ned Lamont, just a week ago, got vaccinated in Bloomfield, where a big portion of its residents are African Americans. So what do you think, Bernard? Do you think people in your community in New Haven are going to get vaccinated now because of the governor, already got vaccinated?
I don't think it's because of the governor that they would get vaccinated. Some may not. But what I'm hoping for is the numbers that you showed, and you showed the disparity between whites and blacks. What people need to understand, no matter the color, is that the same vaccine that our Caucasian brothers and sisters are taking is the same vaccine that anyone else, any other American in this country is going to take. So when you go back in the past, there was vaccines that were given specifically to blacks only. It's different than what we're dealing with right now. We have a vaccine that's going for all people involved. I want to kind of clear something that somebody had said as it relates to, people not wanting to get it for whatever the reason is. People need to understand that getting vaccinated is a choice. You have to make the choice. But what I want you to do is seek the facts for yourself and stop waiting for someone to give you information or not give you information. This information is online. This information, you can Google it. You can Google anything in America now. Google it. Go to your physician, the physician of your choice, the physician you go to for other medical conditions, and ask those questions so you can get the answers that you're looking for. Stop looking online. If you don't trust what you're seeing online or what you hear on TV, you have medical professionals right there in your community, just like we do, and we sending people to their medical professionals who they should go to and get these questions answered. And so I don't really think it's because of our governor who did it, but hopefully if that is what it takes to do it, but do it because you think it's the right thing for your family to do. And if you choose not to do it, what is your plan to ensure your family is protected and safe? What is your plan since you choose not to get vaccinated? What are you going to do to protect your family? What are you going to do to protect your neighbors that live directly next door to you? What are you going to do to protect your whole community that you are involved in? And that's kind of the questions you need to start to ask yourself. What am I going to do if I choose not to take the vaccine? One thing I don't want to do for myself, and speaking only for me, is I don't want to have the lack of freedom that I was given when I became an American, is to be able to walk outside and understand that I'm free to breathe clean air and have a clean life and go to any restaurant I want to go to any place I want to go to. We can't do that right now because of this epidemic. And so if that's our governor is the spokesperson that needs to be the example for us, then let that be. But whatever example you choose, make sure you get the facts for yourself. Make sure the choice you make is specifically for something that you're going to do to protect your families, period.
Jendaya, thank you. Jendaya, definitely. I'm going to open the mic to you because I want you to answer pretty much the same question. The governor just got vaccinated. It doesn't mean that people need to be vaccinated, but what do you think it's happening in Hartford and North End, for example?
And that's the thing. That's the point I was going to make. That I hear a lot from the families that I interact with is, when you say, "Hey, the governor is getting the vaccination. Will you get it because of the governor? Because the governor is getting it." Well, people will say the governor doesn't look like us. The governor hasn't gone through what we've gone through as a people, and that sort of thing. And then going back to what Big Man said in regards to using his platform or no one's going to use their platform from certain standpoints, whether it's celebrities or people in the community, because if something happens later down the line, which people have their beliefs, it's going to come back to haunt that person. Or like he said, they'll say you were paid off and, all these different things. So, it goes further than just advocating for the vaccination, because they want to know, how is this going to affect my job, my reputation, future opportunities for me by advocating for this vaccination that they feel they don't know enough about. So again, these are just the conversations that are being had in our community.
Absolutely.
Can I say something?
On the screen, please, if our producer puts everyone, the panelists, and of course, Jendaya and myself, because we want to share final thoughts over here. And I'm so excited that we're having this conversation. People really need to hear people from the community, right? We're not, probably there's not doctors over here, people that their expertise is in medicine, but we are people from the community, and you guys represent the community. So final thoughts. I'm going to open the mic to Attorney Lucas. Final thoughts on this conversation.
Final thoughts. I think it's going to come down to people's rights, people's choice. I think it's already, from what we see with vaccine cases, where some people decide for whatever religious regions or whatever they believe in to not take vaccines. And I think we're at that same point where some people, for whatever reason may be, if they don't want the vaccine, then they don't want the vaccine. For those who do want it, then make it available. But ultimately, in the end, we gotta do what's ever necessary to keep our community safe and to keep our family safe and make it through this matter.
Absolutely. Thank you so much, Attorney Lucas. So, Eric, final thoughts on this, big conversation.
Well, first of all, I want to thank you guys for having me on. I think my final thoughts, wow, I just hope that we can come to a common ground at some point, because for every argument that someone will make for taking the vaccine, there's going to be someone to make an argument against it. We'll say take the vaccine to protect your family, and they'll say I am protecting my family by not taking the vaccine. And they'll have, each side has valid points. But I think that everyone needs to understand that a large part of this is that this vaccine became available so quickly after this happened. And there's a number of other things where they're still doing research. They're still trying to find ways to cure different things that have been present for years. And here we are, a year plus later, and it's like, okay, we got the vaccine. Let's go. And it's like, wait a minute. Let's answer some questions. Let's answer some real questions. Let's answer some questions about our fears. And there's a level of sensitivity that's required for that. So I don't want to get long-winded here, but thank you guys again for having me.
Absolutely, no problem. Jendaya, final thoughts over here. Oh, before we should go to New Haven. Bernard, do you want to share your final thoughts? And also, on those final thoughts, do you want to share some information, some resources for the people of your community down there in New Haven?
Definitely. My final thoughts is get the facts. Through our research, through our sessions, through our learning sessions, people want to know just want to know the actual truth, and just tell the truth. And people find out that truth in any way possible. Go to your medical providers, go to your health centers, that is your FQHCs in your community, and talk to the professionals there. Go to your personal physicians, wherever that may be. Go to CVS, go to Walgreens, where they're providing this vaccine. Look online, try to get as much information as possible so you are perfectly secure for yourself. If you choose not to take the vaccine, definitely know the information is out there, but come up with a plan, a surefire plan, not something just made up out of a cereal box. Come up with a surefire plan to protect your family from this deadly virus that exists in our country, not just in New Haven or Hartford, but throughout the state of Connecticut and the country of the United States. Definitely check in with your physicians is what I would want to lead people. Go on Fight the Flu, Fight COVID, New Haven site for those that are living in New Haven for information. Again, go to the Yale Health Department, the New Haven Health Department, Cornell Scott Hill Health Center, Fairhaven Health Center, and all the other doctors' offices and practices throughout the city, and get the right information. And as Big Man said, get that information and get those questions answered that you need to get answered. Don't wait to get them answered. Don't think that you have a lifetime to do that. I would try to find out that information as quickly as possible so you can make a surefire decision when it's your turn to get vaccinated. Thank you.
Thank you so much, Jendaya. Now, the mic is open for you. This is a big conversation on big cities, New Haven and Hartford. Final thoughts, Jendaya.
My final thoughts are, I agree with all of our panelists, but I just want to say that this is going to be a long fight. It's not going to happen overnight. You know, we have to look at how many people still don't believe in voting. You know, I was able to convince an old elderly gentleman this past election to come out and vote for the first time in his 70s. And, you know, he said, my mother never voted. I'm not going to vote. You know, so this goes deeper than the vaccination, the pain, the mistrust, and so many other things. But it's not going to happen overnight.
Agreed.
Perfect. Thank you, Jendaya. So I want to share with you a flyer that I found on Hartford 311 Facebook page. So the flyer is right there. If we can share it so people can see it. Pedro, can you put it on the screen so people can see it? It's that's on Saturdays from 10 a.m. to 3 p.m. It's a flyer out there. Again, we're just going to share it right now. There it is. It's on your screen. So Saturdays, February 27th, March 6th, March 13, March 20, and March 27. Those are free COVID-19 vaccines for the Hartford residents 65 years and older. So I'm pretty sure that by that time, after March 1st, those 55 and plus, you know, are going to be able to get the COVID-19 vaccine. Remember, appointment is required, and the phone number is also on that flyer, 860-757-4830. And of course, this vaccination clinic is going to take place on Dunkin' Donuts Park. Thank you so much for sharing that image. And again, it was on 311 Facebook page. Hartford 311. We took that information from there. So Jendaya and everyone else, thank you so much for being with us. This was a very, very good conversation. Thank you for your time and for sharing your thoughts with our community. Thank you so much once again.
Thank you.
Take care.
You're welcome. Thanks for having me.
All right. And everyone, see you next time. This is just the first one, so we're going to see you soon, okay? Because we're going to have more neighborhood conversations regarding the COVID-19 vaccine. Take care, everyone. Bye-bye.